Alrighty, guys. Just a few more moments before we begin today's webinar. I'm just letting everybody else get into the webinar, making sure that everybody's getting in here and able to watch today's seminar. So while we're waiting, obviously pictured above is me and both of my brothers. We are all Medicare insurance brokers. That is all we do is Medicare. So you've got Luke on the left, me in the center on my wedding day, and my brother Hunter, who is our founder. All right. Well, let's get started, everybody. I don't want to wait too long and lose everybody. Um, welcome. Today, this webinar is for Medicare recipients, people getting onto Medicare. If you just want to learn, we're here to do it. If you want to take some notes, make sure you get out a pen and paper. We're going to be putting all kinds of different scenarios out there. You could have a lot of unique situations, and we're going to talk about a bunch of them and hopefully educate you on what you have if you are already on Medicare, or educate you on how to get onto Medicare. So let's get started. We're going to, again, talk about transitioning onto Medicare. We're going to talk about Medicare Advantage versus supplemental plans. We're going to talk about how to get back on original Medicare if you've made the mistake of getting on Advantage plans. We're also going to talk about saving money. If you already have a Medicare supplement, we are going to talk about getting a Medicare supplement with potentially a better premium if it's possible. We're going to talk about different ways they use propaganda on Medicare Advantage advertising. We're also going to talk about selecting Medicare as your primary insurance versus an Advantage plan's managed care, we would like to say. So let's get started. Before we begin, I like a little comedic relief. So are you tired of hearing about food cards that you may or may not be eligible for? This call or webinar is for you. Most people are never going to be eligible for these flex cards. You're going to receive a million advertisements while you're on Medicare about flex cards. Do not be fooled by them. 99.5% of all people are not eligible for these food cards. You have to be on Medicare and Medicaid, okay, state insurance, in order to even come close to qualifying for anything close to this dollar amount. Again, you're going to see it. You'll say, Taylor, I've seen that. And I promise you, it's going to be every year, and they just can't stop the advertising because it is kind of true, but it's just a way of getting you on the phone and getting your business. So, all right. Well, I'm going to introduce myself. I am Taylor Atwood. I am Hunter's oldest brother. He, again, is the founder. I'm the oldest brother. I've been working with my brother since 2016, but I also have the added caveat of being a registered nurse. I've been a registered nurse since 2014. I did travel nursing across the country from Montana to California to Hawaii. Arizona is one of my favorite places. This is me on the Gila River Native Reservation. I worked there during the pandemic. And I stopped nursing altogether in 2022 and became 100% committed to insurance. So I've been doing insurance since 2016. I used to do it part-time while working nursing, and now I've just committed all in on doing insurance full-time. This is me at Cam Hospital. This is my family. This is our best boy ranger and my wife, Kristen. We got married this year, June 8th, 2024. Obviously, Ranger was best dressed at our wedding. So again, continuing on with this is another wonderful photo. There's so much in this photo that I absolutely love. You've got my dad here. He's an EMS supervisor. Him and my mother, obviously all of us get our blonde hair and height from my mom. This is Hunter's wedding day. My uncle has been doing insurance since the 1990s. I've referred him 100 times and asked him so many questions. He's such a knowledgeable individual. He's the reason we all do Medicare. His son, Bridge, has been doing Medicare since 2014. That's all he does as well. So our whole family, again, we're just an insurance family. It's my brother on his wedding day. His wife, I actually worked with her at a hospital and introduced the two of them. So that was their wedding day, and they got married a week after my wife and I got engaged. Then there's Luke. He is the baby, but don't let him fool you. He has been doing nothing but Medicare since high school. So he literally is insurance through and through. So we all try to be as knowledgeable as possible, but we're also a family. So definitely have a lot of years of experience under all of our combined belts. All right. So this is the moment. Have your pen and paper ready, like I've already said, but you can write down my email address if you want to email me personally. We have our office number where you can call and make yourself an appointment. Write that down if you haven't already done so, 1-800-522-2183. And then here's our website, www.medicaresenior.options.com. That is the name of our company. Make sure you stay to the end for our big bonus giveaway. And again, if you have anything that you missed, you can always email, call us, or go to our website and book yourself an appointment there too. This picture is me up in Canada. I got engaged to my wife up there. Love that photo. If you haven't been to Canada, specifically Banff, it's definitely something. It's the most beautiful place I've ever traveled. All right. Let's get off and get running. We're going to start this webinar off with talking about people who are just getting started with Medicare. Getting enrolled in Medicare, usually the process starts out 6 months. You're going to get marketed, talked to 6 months prior. With Medicare and a supplement, 6 months is when we can first start getting your business all squared away. A lot of agents like to create a false sense of confusion. Let's try to clear that up from the beginning. Are you drawing Social Security? If you are drawing Social Security, you are going to be automatically enrolled with Medicare Part A and B on the first of your birth month. So the only exception to that rule is if you're born on the first of the month. So for an example, if you are born December 1st, 1960, your Medicare Part A and B effective date will be November 1st, 2025. Other than that, if you're born December 30th, December 15th, December 2nd, your effective date will be December 1st. Okay, so again, born on any other day outside of the first of the month, your effective date will be the first of your birth month. If you're born on the first, yours will start 1 month ahead of time. Make sure that you look out for your Medicare card 3.5 to 4 months prior to the first of your birth month. That is when it will be coming. Okay, make sure it'll say A and B. Again, that is if you are drawing Social Security. So, what happens if you're not drawing Social Security? You will need to make an appointment with Social Security or apply online 3 months prior to your 65th birthday. Sorry about that. It takes about 4 to 6 weeks to generate your application. Again, Social Security, Medicare, they're slow. There's nothing else we can do as brokers to speed that process up. So it's critical that you get applied on time if you're not drawing Social Security and have plans to take Medicare. Okay? We can also send you instructions if you make an appointment to make that a lot easier to apply online. What if you're still working? Okay, this is a great question. If you have a job that has more than 20 employees, you have the option to keep your work insurance, or you can get onto Medicare. It's whatever is going to be best for you. I've run into people with work insurance that cost them $1,000. If you're paying a ton of money for your work insurance, get onto Medicare. You're probably only going to pay $300 to $500 a month versus what that is. And it's also going to be way better insurance than what work insurance is. Most of the time, work insurance has $5,000 deductibles, $10,000 deductibles. You're going to run into it all the time. If your job has less than 20 employees, you have to get onto Medicare. Again, I'm going to say that again. Less than 20 have to get onto Medicare. No other option. If you do want to talk about your work insurance versus Medicare and you want to make an appointment with us to go over it, get a summary of benefits, an SOB or an EOC, evidence of coverage. All right, get it from your HR department. They will send it to you. Have that on file prior to our appointment so that we can actually make the comparison. If not, we're just meandering around. You could say, hey, I'm paying $150 a month. For what? We don't know. We have to have that information in order to give you at least a decent comparison. And if it's better to stay on your work insurance, it'll be evident by looking at your summary of benefits and evidence of coverage. If it's better to get onto Medicare, it will be apparent. You'll see it and you'll say, okay, looks like Medicare is the better option for us. So have that ready. Those are the things that we need to have on file in order to kind of take a look under the hood and see if it's going to be the best choice. If you have more questions on Medicare enrollment, make sure you book an appointment. We will be glad to talk with you. One of our assistants will be glad to get you squared away and get an appointment on my calendar. If you delayed Medicare, say you kept working and you're in this situation where you've delayed Medicare, did you take Part A? Have you been issued a Medicare number? You should take Part A. It is free. It's what you pay all your taxes for, all right? If you didn't work long enough, you don't qualify for Part A with premium to be premium free. So when people think, hey, I put all this money into it, you're paying for Part A, which is Hospital, which is nursing facility. That's the part that you've earned and paid into. Part B is what has the premium. We'll talk about that later. You can apply for Part B at any time. So say you have work insurance now that you're not necessarily happy with, whether it's cost, whether it's high deductibles, networks, whatever it may be. We can always compare Medicare to your current work insurance. All right, so let's get into the meat and potatoes that everybody's interested in. Okay, it's Medicare. All right, these are for folks that are on Medicare, and if you're just getting onto Medicare, this is going to be valuable information for you. So we're going to talk about Part C, or Medicare Advantage plans, or the all-in-one plans, all right, the cheaper alternative. Okay, we're also going to talk about traditional Medicare, which is what we're going to favor every single time. Regular Medicare is always going to be better than Medicare Advantage. However, on a dollar per dollar spend, Advantage can have its pros and cons just like anything in life. We're going to talk about quality of regular Medicare, and we're going to talk about Advantage. So we're going to try and give you the straight truth and just make it as informative as possible. So here we go, guys. Medicare Advantage was founded in 2003, and it's what combines your Part A and Part B into what's known as Part C. Okay, you convert your pure A and B Medicare card, okay, into what's known as an Advantage plan. Okay, this is provided by private insurance companies: United Healthcare, Aetna, Cigna, Blue Cross and Blue Shield. All of them have Advantage plans, all right, HMOs or PPOs. If you have a relative, family member, friend that has a supplement that has HMOs and PPOs, they're on an Advantage plan, not a supplement. I can't tell you how many calls I've had with people who think they have supplements when they've actually been converted to Advantage plans. So when you go to doctor's offices, you use your Medicare Advantage card, all right, your PPO HMO card, all right. You only use one card when you're on Advantage, okay? If you have an HMO or PPO, that is the only card you will have, okay? You have your built-in drug plan. It's a drug card. It's a doctor's office card. It's a hospital card, okay? It's all in one. So it is a managed care, okay? It will be managed by United Healthcare, by Aetna, by Cigna. They're the ones approving or denying your claims, okay? Regular Medicare, okay, will consist of 3 cards. Medicare card, which I've already highlighted, okay? You will have a Medicare supplement card, which supplements your Medicare at 20%, okay? And then you will have a drug plan that is separate. So you go from 1 card with Advantage to 3 cards with traditional Medicare, okay? Medicare will be your primary. It was founded in 1968. It's been around forever. It's not changing anytime soon, no matter what the political landscape looks like. So you'll have 3 cards that you'll utilize at a doctor's office, or at the pharmacy, you'll use your drug card, okay? So that's the basis of what it looks like, okay? No matter what, guys, you are going to pay the Part B premium of $185 in the year 2025. At a minimum, you typically will pay that unless you have a low income and have state Medicaid coverage, or you make too much. Okay, so if your income is above $106,000 individually or $212,000 as a couple, we will talk about the income-related monthly adjustment amount. If you make too much, they will increase your premium, unfortunately. There are ways to appeal it, ways to get it put back to $185, but we'll go into more detail on your individual call and what the cost of Medicare will be. But no matter what, that is the ticket of admission. You pay $185 no matter what, $185. Whether you take A and B or you take Advantage, it's the cost of admission. Okay? All right, let's move forward. One thing I love doing in these webinars is talking about your Medicare and You book. Yes, that 150-page miserable thing. All right, I pull out a few pages that actually are worth something, and I cite them here so that you can find them and show them to your friends so that you have the power to educate them yourselves. All right, there are 2 main ways that you can get onto Medicare, okay? There's original Medicare, all right, which is what I had on the right of the last screen, okay? So this, all right, there is this, all right? That is original Medicare. Again, you'll have A and B. A is everything that has to do with the hospital, nursing homes, this rehab, some variants of hospice are all filed under Part A when they are billed when you are on Medicare. Part B is everything outpatient, okay? doctor's visits, medical equipment, infusions, chemo, radiation, all of that falls under Part B, as in boy. So what are the benefits of regular Medicare? All right, this is your book speaking to you, okay? You can take any doctor or hospital that takes Medicare anywhere in the United States of America. That's not me saying it, okay? That is your book. All right, this is Medicare. We didn't just make this up. You can turn to page 10 of Medicare and You, and it's right there, okay? Again, on this one, you'll have 3 cards. You'll have your A and B card, red, white, and blue. You'll have your drug plan that we will help you get enrolled into and look over and find. And then we will get your Medicare supplemental policy set up as well. We're going to go into more details on supplements here in just a little bit. The other thing you can do, again, and I say this twice, and just so that you have 2 different diagrams to either write down the notes or completely understand it yourself, you can convert your A and B into what's known as Part C or Advantage, okay? There's a lot of different verbiage for it, okay? It reads right here. It is Medicare Advantage is a Medicare-approved plan from a private company that offers an alternative to original Medicare, okay? In many cases, you can only use doctors who are in the plan's network. In many cases, you may need to get approval from your plan before it covers certain drugs or services. There is a lot more steps to approval with Advantage. They typically make things more difficult in that regard. You will get more denials. I'm not saying it's the worst thing in the world. I'm just saying there are the pros and cons of it. It will include drug coverage. So with regular Medicare, you have a standalone drug plan. They call them standalone PDPs right here, okay? With Advantage, they typically include Part D drug plans. There are some Advantage plans that don't have drug coverage. Be careful that you don't get enrolled in an Advantage plan without drug coverage if you are not a veteran or with TRICARE or have some form of creditable drug coverage. This is, again, we're going to keep using this Medicare and You book, page 11. All right, at a glance. All right, this is where Medicare is telling you this exact information that you need to see. All right, original Medicare, you can use any doctor or hospital that takes Medicare anywhere in the U.S. Okay, folks, it's right there. Whether you're in Nome, Alaska, or Key West, Florida, you can use this policy anywhere. In most cases, you don't need to get a referral to use a specialist. Okay. Now let's look at Advantage. In many cases, you can only use doctors and other providers who are in the plan's network and service area. I didn't bold this page. It's bold in your book. You'll see that, okay? You may need to get a referral to use a specialist. Most of the time, you're going to need referrals, okay? Prior authorization is a very familiar word you're going to need to get familiarized with Medicare Advantage. Now, this is something that is the most important, one of the more important things that I'm going to say. There is no yearly limit on what you pay out of pocket unless you have supplemental coverage on the original Medicare side. And just think about that for a moment. There is no yearly limit. We wouldn't be talking today if all you ever needed was A and B. The reason that I have a job is because you have to make a decision. Am I going to go with original Medicare and a supplemental policy, or am I going to go with Medicare Advantage? Okay. Medicare Advantage has a yearly limit. Okay. So it would be completely foolish to just keep A and B because there's no yearly limit, period. If you had $100,000 surgery, which is nothing nowadays, you would have a 20% coinsurance. Okay. It says right here, for Part B covered services, you usually pay 20% of the Medicare approved amount after you meet your deductibles, okay? This is called your coinsurance. So if you had Part B and you had $100,000 worth of chemo, radiation, infusions, whatever it may be, you're on the hook for 20% without a yearly limit. The way that you put that yearly limit on is by picking up a Medicare supplement, okay? Medigap, all right? Now, I like to point this out, all right? Medicare supplement, Medigap, they're the same thing. There is no difference between the two, all right? People say, I've got gap insurance, I've got supplement insurance. They're the same thing, okay? Don't get fooled by that, okay? So, Advantage plans, it's better to get an Advantage plan than to not have a supplement to begin with at all. So, it's, again, very, very, very important to pick up a Medicare Advantage or a supplement plan so that you don't have to worry about not having a yearly limit on what you can or can't spend, okay? Medicare supplements, you get 6 months before your effective date and 6 months after to get them without any health underwriting or questions. Okay? I'm going to say that again. 6 months before, 6 months after. You have to pick out a Medicare supplement without any health questions. No pre-existing conditions, nothing. You could have stage 4 lung cancer. You could be the healthiest person on earth, and you get that supplement. Supplements are not always guaranteed. It's like full auto coverage before you drive your car off the lot. All right, that's what supplements are more similar to. Advantage, you can always go to Advantage. All right, you could have horrible health, great health. Advantage does not care because all the liability is on your shoulders. Okay. Again, liability versus full coverage. It's exactly what we're talking about. All right, Advantage plan, the risk or liability is on you. All right, you just pay the Part B premium of $185, and in some cases you can pay an additional premium if the Advantage plan has an associated premium. $0 a month most of the time on top of the $185. Medicare supplements / Medigap plans. All right, the risk's on the insurance company. The cost is usually $60 to $120 a month depending on what plan you pick. Some states, Florida, Missouri, California, typically have a little more expensive supplements. Why? There's no reason or rationale behind it. They just do. New York, definitely a big one with the cost of supplemental plans. If you have a New York Medicare supplement and you've moved or retired and moved somewhere, call us. We will help you with your supplement. Now, this is something I say to everybody. You're going to hear me say it to you probably on an individual basis. Is your health comparable to auto insurance? The answer is no. Okay, if I said, hey, I'm going to give you $100 million and it's non-transferable, but you can never walk again and you're going to have Alzheimer's, you won't remember a thing, would you take that $100 million? The answer is 99.9% of the time, no. Okay, and that's just because your health is your most valuable asset. There is no asset that you possess that's more valuable than your health to you. So treating your health insurance like auto insurance or a cable bill or internet bill, sometimes you just got to spend a little more money when you know that you're going to be taking care of yourself a little bit better and having more options and getting the best treatment when that time comes. This is a quote that I absolutely love from Julius Erving. If you don't do what's best for your body, you're the one who comes up on the short end. Okay? It's very pertinent to this situation with Medicare. So I'm going to start off with going over some of the Medicare disadvantages, and then we'll transition over to traditional Medicare and supplemental. So let's start off with the intended benefits of Medicare Advantage plans in 2003. The original advantages that were supposed to happen is it was supposed to expand your choices for your beneficiaries, control your health care costs, improve your quality of care, and offer additional benefits to your enrollees. What really ended up happening was more complex coverage rules, more claim denials, inconsistent plan benefits, changing benefits, high out-of-network costs by hospital systems dropping Advantage plans altogether, misleading marketing practices such as your food and grocery and flex spending cards, restricted provider choices, allegations of overcharging and false claims, ongoing debate and scrutiny regarding your program effectiveness and fairness, physicians, again, exiting your network, AI making your decisions for you, whether you can get approved for a surgery or not. Again, Advantage, we can make it work for you if you financially are not able to make traditional Medicare work, but it's definitely not what both my grandparents are on. Medicare Advantage plans have problems across the country. And this slide just goes to show all the different, and it's not just this slide, it's the next slide that we're going to talk about too. All of them these are all different hospitals across the country, whether it's Vanderbilt, Wake Med, Duke, North Carolina, MD Anderson. They all have a revolving door of changes that Medicare Advantage plans you're going to have these problems where they're dropping hospital systems and then they're picking them back up, or renegotiating and then dropping, and then physicians networks dropping them all together one year and picking them up the next year. The reason October 15th to December 7th is such a big deal in the advertising space is because of Advantage plans. They're always going to need to be checked up on typically, unless your doctors remain in network, but normally Advantage is going to change every single year, whether it's your max out of pocket, your deductibles, they're always changing. Regular Medicare is far more stable. Okay, they're more consistent. Your benefits rarely change in most instances. So these are just a few of the companies that are changing. If you see one that you're familiar with, we can't list specific companies. So Again, here are more of them: Ohio State, West Virginia, again, Vanderbilt, Carson Tahoe. I've just actually dealt with somebody who's had problems with Carson Tahoe with their Advantage plans because nobody takes it in that area anymore. So you're going to have problems. That's okay. As long as you're patient enough to work around Advantage, again, we can make it work for you. It's an option that we offer. It's a necessary evil that we offer. And maybe you have a great experience with Advantage. But if somebody ever speaks glowingly about Advantage, they typically haven't had a ton of health issues to complain about. So anybody that's had a lot of health issues, or maybe you have a friend or family member that's had regular Medicare and been really sick, and you remember mom and dad never paid anything, well, that's probably because they were on regular or traditional Medicare. This is a common myth. You must get paid more to sell a premium product. Traditional Medicare, all right, you pay that along with a supplement that's $60 to $120. We get actually paid less, all right? A Medicare Advantage plan, and this is a shocker because the government subsidizes Advantage plans, but the commissions are typically $600 or more with an Advantage plan enrollment, all right? That's why every agent, especially turning 65, they're going to really want to push you into Advantage plans, okay? Double the commission, almost triple. Medicare supplement commissions are typically less, okay, which is why agents don't push them quite as hard, okay? So supplements, we still prefer them because we know that they're the better option. They may be a tick more expensive, but they're going to make your life far more easier. Now, again, this is a page. These are all the ads you see every single day. You're going to see old Joe Namath talking about Advantage, or he's going to be talking about all kinds of different options that typically aren't in your best interest. But we still like showing everybody all the different advertisements I'm sure you've seen every single day, especially during the fall for the last 15 years. Again, food cards, foods. Everybody's always going to be pushing these flex cards. Don't fall for it. Don't let them change your enrollment. Don't let them push you into something that you're not comfortable with. We always will do a double check free to make sure that everything is in place the way it should absolutely be. Again, Advantage has a bigger commission associated with it. So you can change, and let's flip gears to regular Medicare with supplements. You can change for those of you who have Medicare supplements, you can change your Medicare supplement any time of year. Okay, there is no special enrollment periods with supplements because they're optional. The government does not mandate that you carry a supplement. They are optional. So we can make a change any month of the year. If you have an old Plan F, you can qualify for another Plan F. All right. The only rule that happened January 1st, 2020 on Plan F is that if you have a Plan F, you can continue getting Plan Fs for the rest of your life. The people that are newly eligible for Medicare starting January 1st, 2020 and beyond are not eligible for Plan F anymore. So those of you with old Plan Fs paying a high premium, give us a call. If you have a friend, family member that has a Plan F that is expensive, we can at least take a look and see if we could save you. And I've saved people so many times, $80 to $100 a month on Plan Fs, and it's the same Plan F. All Medicare supplements are standardized. There is no difference between a Blue Cross Plan F, United Healthcare Plan F, Aetna, Cigna, any company's Plan F Medicare supplement. So, and that goes with F, G, or N, okay? So let's take a look at this. Plan G, all right, most agents are going to recommend Plan G. Why? Plan G is the biggest Medicare supplement, therefore it has a bigger commission. Most agents like Plan G. It's easy to explain. Plan G Medicare supplements. You pay nothing at the hospital, and you have an annual $257 deductible. $257. Write that down. $257 annual deductible. Now, that is the same for plans G and N, okay? It's not a plan, a Medicare, supplemental Plan G, Plan N deductible. It's the Medicare Part B deductible. I'll show you that in a chart here in a moment, but it's not a company-specific deductible. All right, once you meet this with Medicare, it's paid for the year. Okay, so if you had a Plan G and you have Mutual of Omaha, okay, Mutual of Omaha and Aetna and Cigna's Plan Gs all have the same exact Medicare Part B deductible. So let's go ahead and take a look at a chart, and it's going to go over all of this as well. So this is on page 76, guys, of Medicare and You. So if you have your books out, take a look at page 76. This is the Medigap plans chart, okay? You can pull this up, show your friends, whatever you want to do. So here is Plan G, and here is Plan N, okay? When we go down the line, the Medicare Part A coinsurance is covered identically by G and N, okay? The Part B coinsurance, G, 100%. N, okay, it says 100% with these 3 asterisks. So what are those 3 asterisks? Let's go ahead and look at it. Plan N pays 100% of the Part B coinsurance. You must pay a copay of up to $20. And again, I'm going to stress up to $20 for some office visits and up to a $50 copay for an emergency room visit that doesn't result in an inpatient admission. Okay? So again, it covers 100% of your 20% coinsurance. All right? But it has an up to $20. I've had somebody with a $16.77 copay, somebody with a $5 copay. Plan N is the better, on average, we're going to prefer a Plan N over a Plan G just because on a dollar per dollar spent, it's the better value plan. You're going to have to see a doctor 12 to 15 times a year to justify carrying a G over an N. It's more to explain, okay? But we do prefer N over G most of the time. Now, if the 5% of people that we write on Plan G, okay, are people that either want more convenience or they have a lot of pre-existing conditions, stage 4 cancer with lots of visits and probably a terminal case. Somebody with early onset Alzheimer's, probably a Plan G. One thing that Plan N does have is a potential for a 15% excess charge, okay? So right here in highlight, it's very rare. It is not common to have excess charges, okay? I've been doing this since 2016. My uncle's done it since the 90s. We have never had somebody with an excess charge. If you Google excess charges, the reason that is doctors know on a dollar per dollar spent what they can charge and what Medicare will pay. So they charge everybody the same amount. If you have a Medicare Advantage plan and then the next person has regular Medicare, he can't charge the Advantage more than he can charge original Medicare. So most of the time, you will never see an excess charge. If they were a problem, I assure you I would never in my life recommend a Plan N. We get more money to sell Plan G. I would spruce it up and make it sound so much better than N that it would scare you to death to ever get enrolled in a Plan N. So we favor Plan N because both my grandmas are on it, and it is typically going to have smaller rate increases on an annual basis for Medicare supplements, which brings me to my next point. Medicare supplements do get a little bit more expensive every year, which is another value that we can give to you. We can help check up on your prices and help keep your Medicare supplement competitive year in and year out for your premium. Let's move on to page 77. All right, what else should I know about Medigap? All right, if you're thinking about buying Medigap, be sure to compare plans. The costs can vary between plans offered by different companies for exactly the same coverage and may go up as you get older. So that's just what I just said, but this is your book, Medicare and You, 77, all right? They're all the same. So if somebody thinks their Blue Cross or United Healthcare, Aetna, Cigna, F, G, or N is better than any other company, there is no magic Medicare supplement company in this business. All right, they are all the same. Okay, so let's go into, again, hospital stays. If you go into the hospital, $0. Medicare supplements cover your first 100 days in the nursing home, $0. That's Plan G or Plan N, okay? Home health care, $0. Emergency, $0 unless you don't get admitted to the emergency room, $50. Urgent care, $0 for the Plan N Medicare supplements. Outpatient, $0. Again, this is all bearing that your Part B deductible of $257 has been met. Medical equipment, diagnostic tests, okay? MRIs are not cheap on Advantage. Mental health, substance abuse, PT, OT. Again, if that deductible has been met, you are going to completely have $0 copays across the board. We have tons of Medicare supplement companies, guys, for a vast amount of reasons. All right, Medicare supplement companies, we have all the mainstream ones. But we also carry smaller ones because this is a cutthroat business and there's a lot of agents that will offer whatever price they can get to you. So we have all the best prices in the industry along with all the major companies. We typically try to stick with bigger companies that have been around a little bit longer. But if you really want the best price out there, we can find the smaller companies or add the smaller companies to get you to the best price in the market if you just want the tiniest company with the best price. We don't typically recommend it. We only recommend A-rated carriers. Okay, so that's another thing that we are very proud of. We don't offer all the tiny little companies that are B-rated or below. All right, this is a common myth, guys. Doesn't it have to be October 15th to December 7th for me to change? It does not. There are so many different enrollment periods throughout the year. All right, so October 15th to December 7th is obviously the chaotic period, all right? Everybody's calling. Everybody wants to check their Advantage plans because they need to be checked. And then Medicare recipients who have regular Medicare need to potentially look at drug plans. If you're on a drug plan that's $0 and you don't take any drugs, there's not much we can do for you, okay? You're probably going to roll that drug plan into the next year unless they change the premium of it to something extreme, which can happen. Drug plans and Advantage plans can change their premiums or benefits every single year. Okay, that's the big thing with regular Medicare that we need to check, your standalone PDP. The annual enrollment period is between October 15th and December 7th. That will never change. That's always the same. So at that time, you can switch, join, or drop Advantage plans. You can go back to regular Medicare or Advantage or enroll in a different drug plan. That's what that time is for. A lot of people, there is the Medicare Advantage open enrollment period for current Medicare Advantage plan members only. Okay, so if you have an Advantage plan right now and you're thinking, how in the world did I get on this Advantage plan? You can get transitioned over to traditional Medicare at this time. All right, January 1st to March 31st. You can change your Medicare Advantage plan with or without drug coverage, and you can switch it back to regular Medicare and then add a drug plan. We will help you do all of that. We will run the quotes, double check and see what's in your budget, and help you get switched over so that you have a better plan. There are tons of special enrollment periods throughout the year as well. If you move to a new area, if you have a bad Advantage plan, you can do a 5-star enrollment. If you have natural disasters, losing work insurance, if you have a change in your Medicaid status, significant plan rating changes, there are tons of different options for you. For TRICARE recipients, most of the time you don't need to do a whole lot. All right, you're going to have traditional Medicare with your TRICARE. So, again, if somebody tries to push you out of TRICARE and onto an Advantage plan, I would second guess that if you're on TRICARE. For VA, there are specific Advantage plans that are built for you. So make sure that when you're looking for Advantage plans that you are looking at the VA Advantage plans that we will talk about with you. If you don't want an Advantage plan, which we always recommend, and you just want traditional Medicare, then we'll talk about that as well. But there are several special enrollment periods throughout a year that we can help make adjustments or changes to your health insurance. There are tons of health problems at age 65, cancer, heart disease, heart attack, stroke. Okay, there are generic drugs, there's preferred brand names, non-preferred, and specialty drugs, okay? Tons of different drugs that you're going to be put on. Now, luckily for you guys, there is a maximum out-of-pocket limit of $2,000 a year now for drugs. That is way better than it was several years ago, where you could spend anywhere between $6,000 to $4,000 a year on drugs with donut holes and everything else. The donut hole has now been eliminated starting in 2025, okay? Done. Not a problem anymore. They got rid of it altogether. You will spend no more than $2,000 in a single year. However, it doesn't change the fact that prescriptions are still expensive. All right, if you get prescribed one drug, Eliquis, Xarelto, you're typically going to be out anywhere between $1,200 and $2,000 a year if you have a heart attack or a stroke or cancer. Okay, generic drugs. All right, these are your levothyroxines, your lisinoprils. Sound familiar? Those are your generic drugs. They're tier 1 and they are free. Most of the time, if you're in an in-network pharmacy with your drug plan, $0. Generic drugs, okay? These are your venlafaxines, your statins. They're typically $0. The preferred drugs are your Eliquises, your Xareltos, Mounjaros, Trulicities. Metformin is a generic, but I don't know why I thought of that with Trulicity. But those are going to be your preferred ones, and that's where you're going to start having to pay a deductible. A lot of drug plans have a $590 deductible this year. That's very normal. Okay, the $0 drug plan is a very popular drug plan. As far as drugs go, they're going to have, whenever you're on a drug that's expensive, Eliquis, Xarelto, you're going to pay the $590 deductible before your plan even starts chipping in. So when we do your call, we will explain that far more. But the reason we're talking about this right now is, again, one heart attack or stroke and you're on the hook for $2,000 a year for potentially the rest of your life, which is why we love heart attack, cancer, and stroke policies. Okay, because again, cancer, there's always a time, and again, if you have a predisposition to cancer, it's never a bad idea to have some coverage and make sure that it's there available so that it's tax-free money so that you can have that. One thing, this is something that I explain to everybody all the time. You're on Mounjaro, Trulicity, Ozempic. You got, the savings cards, okay? Those are great, but read the fine print on every single one of their websites. This is pulled from Mounjaro and Eli Lilly, okay? For eligible commercial insured patients with Mounjaro, okay? This says it for Ozempic, for any medication that's expensive that you're getting for a cheap cost. Governmental beneficiaries are excluded, okay? Federal insurance is excluded. All right, here's Eliquis. All right, if you are insured by commercial insurance and your prescription coverage does not cover the full cost of your drugs, that is, you have a copay obligation for Eliquis. All right, usually you'll have your small copay. You do not have prescription insurance coverage through the state or federal health care program, including but not limited to Medicare, Medicaid, Medigap, VA. All right, if you have federal Medicare, you are going to have to start paying if you are getting onto Medicare. So that is a consideration that we're going to have to go over. Okay, if you have medications like Xarelto, Mounjaro, Ozempic, you're going to have to start paying a lot more for your prescriptions. So we'll talk about that more in our appointments. Now, here's more details on the cost of cancer and blood thinning medications. All right, Medicare is always going to cover the tried and true cancer medications, chemo, radiation, infusions, but any of the newer, later, greater stuff that may be experimental that you may have to be trying is always going to be out of pocket. So cancer coverage is so cheap and such a good asset to have in the event that you have something like that pop up. A lot of them aren't going to be in your PDP's formulary, so you may have to pay for them out of pocket, okay? They can be anywhere between $8,000 and $16,000 with some of these different cancer medications for Part D. Again, it's not subject to the 2000 if it's not a network, not approved by your formulary, if it's a later and greater medication. So we cover that gap in your insurance up by giving you that cancer coverage. Again, Xarelto, all right, Eliquis, they're in the same category. Warfarin is very, very rare. I'm sure your parents could tell you stories about warfarin. It has a lot of different problems. It is cheap as dirt, but no doctors want to put anybody on warfarin anymore. The blood testing is miserable. I've seen it firsthand myself, the thinning of the skin. Xarelto is a lot easier to work with, but it's more expensive. So it's nice to have heart and stroke coverage, especially if you are a diabetic. You have a 300% more chance of having a heart attack or a stroke than the average person. So make sure that we get something in place there. You will thank me later. I've had countless people we've filed claims on with heart and stroke policies. So, again, we normally will run $10,000 of tax-free coverage on cancer, $10,000 of heart and stroke coverage. I've had some people, we've done both of them, $10,000 with heart and stroke, and then they've had cancer later on, and we've filed $20,000 of tax-free money that has gone into their pocket. All right? You use that money how you see fit. If that's more therapy sessions after a stroke or a place that, you've gotten as many treatments as you can that Medicare will pay for and you want extra therapy at home, you can pay for it. You can use that money. If you want to put yourself up at the Cleveland Clinic, all right, you can pay for a hotel with that money. It's your money. It's tax-free, and it's so cheap. So this I'm going to pull from Medicare and you guys, flip to 55 and 56. If you do have that out, or you can just write that down to revisit this later. All right, this is transitioning from page 55 to 56. These are some of the items that original Medicare doesn't cover. All right, they don't cover eye exams. All right, cost for prescription eyeglasses or contact lenses. They don't cover long-term care. I'm going to say that again because I know that all of you have had mothers and fathers with long-term care. Medicare does not cover long-term care, guys. All right, they only cover 100 days. Okay, 100. All right, so I'm going to write that down. 100 days. All right, whether you're on Advantage or traditional Medicare, it does not matter. Day 100, you are 100% on your own. There is nothing we can do to change that. Medicare's been 100 days forever. Okay, so they, again, won't cover vision. They don't cover any kind of dental. Okay. In most cases, they're not going to cover dental services like routine cleanings, fillings, tooth extractions, or items like dentures. However, in some cases, original Medicare may pay for some dental services closely related to certain covered services like a heart valve repair, organ transplant, cancer-related treatment. So if you have any kind of dental issues with those kinds of treatments, they could potentially cover the cost of that. Very rare circumstances, though. So we will take a look at that. Paying for long-term care. Medicare and most health insurance, including Medicare supplement insurance, doesn't pay for non-medical long-term care services. This includes personal care assistance like help with everyday activities, including dressing, bathing, and using the bathroom. Non-medical long-term care services may also include home-delivered meals, adult health care, home, and community-based services, and others. You may be eligible for some of this through Medicaid, okay? Or you can choose to buy private long-term care insurance. So if you're watching this webinar and thought, you know what, I've been procrastinating on long-term care for so long. I need to look at it. For a genuine long-term care policy, it's probably a little too late unless you have an extra $400 to $600 sitting around. Fortunately for you, we definitely have some options with long-term care that we really do love, and they're a hybrid. Okay, they're a lighter version of long-term care. So the average stay for an American that goes in the nursing facility, 70% of all people will need some kind of assisted living or nursing coverage. Okay, hence the reason for our recovery/long-term care. All right, Medicare, Plan N or Plan G, again, cover the first 100 days. All right, and then you get a strict 60 days of home health care services. All right, our light version of long-term care takes you from day 100, all right, for an additional 360 days or about a year. My rule of thumb is if you're not better by 460 days in a nursing home, you're probably not getting better. And you're not as worried about financial assets at that point, okay? There's nothing worse than having a married couple where one person gets put in the facility and they are draining the assets of the other, and it's going to make the other person's life far harder than it would have been if you just had one of these plans. They are a great value, and usually combined, you're looking at a policy that could pay anywhere between, I think it's $100,000 and $185,000 out on your behalf. So it's something that for me as a nurse and discharging people to nice facilities and they're going to pay anywhere between $6,000 and $12,000 a month for that facility for a private room. $6,000 for a semi-private at a really bad facility, which we've all visited somebody in a really bad nursing home. If you have regular old-fashioned Medicare, you're not going to go into a facility that's that kind of facility. All right, Advantage is going to potentially force you into one of those facilities. And again, that's not all Advantage plans, but I've discharged enough people with Advantage plans where you have a 6 to 10-day wait to get into a nicer facility. The facilities that nobody wants to go to are the ones that are easier to go to in the same day. Regular Medicare will give you better access to facilities. And that's something that I should mention as well. One of the biggest advantages of regular Medicare is not just doctors, okay? I can't stress this enough to you Advantage policyholders. All right, when the time comes that you are ill and you need to be put in a rehab facility, Advantage is going to cut your options anywhere between 25 and 38, 40% of rehab facilities, nursing homes in the area, okay? You're going to notice that significant difference with traditional Medicare where 90% of all those facilities are in network. Okay, they're everywhere. And say you want to be close to kids, okay? Say that your kids want you close so they can come visit you. Regular Medicare, say you live in Florida and you want to, your kids are in Minnesota and you want to live near them and your family's willing to fly you back while you're ill. You can be in a rehab facility and approved at that rehab facility anywhere in the country with traditional Medicare. And that's such a big sticking point for me that it gives you so much more flexibility to make those choices when that time that difficult time comes. So this nursing or recovery care works everywhere. We love this policy. I can't tell you how many people we get enrolled in this plan and how many people have used this policy and thanked us. I've had a policyholder who got admitted to a nursing facility for 6 months with temporary dementia, and he ended up using this policy, okay? And it paid $36,000 out on his behalf and 3.5 months of being at that facility. That's a huge chunk of change for most people. All right. You can carry this policy for 40 years and it will never surpass what it could potentially pay out on your behalf. On a dollar per dollar spend, it is a fantastic plan. It'll pay $200 to $400 a day for 360 days in the nursing home. And then on the flip side of that, say you want to be treated at home. All right. Which, let's not kid ourselves. We'd much rather be home than in a nursing facility or assisted living. This policy will pay $1,200 a week for 52 weeks for you at home with home health care. So if you can't do 2 of your 6 activities of daily living, all right, you can't dress yourself, comb your hair, brush your teeth, bathe yourself, this policy kicks in, all right, and it pays you or your family members $1,200 a week. It can give your family that money. So if you're living with one of your children, it can give them some money so that it helps take the burden off of them, okay? Because I'm sure that those of you who have taken care of family members, parents, friends, family, I hate to say it, but it is a bit of a burden, all right? It's not easy taking care of family, but nobody takes care of family the way family does. All right, never expect a nursing home to take care of your loved ones the way you would take care of them, all right? There's nobody that cares about them the way you care about them. So that $1,200, It helps. Okay, every little bit helps, and it pays that $1,200 for 52 weeks. That's $63,000 it'll pay out over the course of a year. That kicks in if you have dementia, Alzheimer's. It kicks in if you can't do your activities, daily living after a stroke, or just plain old age. But again, this is a policy we can't recommend enough. It's not. You don't have to sell the farm paying $400 to $600 a month for a genuine long-term care, but it's a good hybrid option. Okay. So these are our recommended packages, okay? Our bronze package is our base package, all right? It's going to have plans G or N, all right, whichever you choose. We're going to get your drug plan squared away, get you enrolled. It's going to have dental, vision, hearing, all right? We've done a lot of research on dental, vision, hearing. We'll talk about that in a bit. Silver package is going to have the drug plan. It's going to have the dental, vision, hearing, and it's going to add your cancer, heart, and stroke insurance, okay, so that you can have that, and it's going to bulletproof your insurance even more and your drug coverage specifically. Then we have our gold package, okay? Gold package has everything that I just mentioned along with that light version of long-term care insurance that has the home care and the nursing facility care. That is obviously our highest recommended plan. If you want to take time to screenshot this or take a photo of it with your phone, take a moment to do so. I'm going to grab a drink of water. Common myth, all right? I must have to pay a fee to use a broker and get their help with all of this. We don't charge any fees. Okay, the insurance companies pay us plenty. You already saw what our commissions look like between Advantage and regular Medicare. There are agencies that charge fees. Don't ever use them. All right, if they try to charge you $800 for one person, they can't offer anything more. All right, they're just dressing it up and trying to act like they're doing a bunch of stuff that we do free. All right, that's our obligation to you, putting your trust in us and going with us. That's what we're here to do, is make your life easy and make this decision very, very easy. Okay? So right now, today is just a base call. Okay, it's phase 1. It's Medicare education. All right, if there's anything that didn't make sense, okay, obviously get yourself an appointment on the calendar. Let's explain it. Let's talk about it. If you're not happy with your Advantage plan, let's educate you on it. Let's punch in your Medicare number and see what Advantage plan you're enrolled in and what adjustments can be made. That's what we're here to do as your brokers, all right? You don't have to do this on your own, and there's no reason to, all right? We're specialists in Medicare and health insurance and life insurance. It's what we do every single day, all right? If you have, an auto insurance person, that's what they do every day. That's what you go to them for. I always advocate in insurance, go to the person that specializes in what they do every single day. All right. If you're getting your tires changed, you go to a tire place. You don't go to a transmission shop to get your tires rotated. You don't go to a transmission shop you don't go to a tire shop to get your transmission serviced. Same principle. So today is the Medicare education phase, and then enrollment advice. We're free consultation. All the Atwood brothers, and then we have our cousin Bridge works with us, and our assistant Dalton. All of us work together. We love what we do. We'll give you the best enrollment advice we can and try and help you make the adjustments that are necessary and what's in your best interest. Again, we've got our bonus item, which is going to be a special item on our best dental, vision, hearing plan. Now, we've looked at all the dental, vision, hearing plans. There is one that stands out amongst the rest of them. That is our bonus video for this video. Make sure that you stay to the very end here, and we will send you that link, okay? Also, this is something that's important. It's not necessarily our main focal point at the very beginning. We're going to get your Medicare squared away, but don't forget to ask us about life insurance, okay? It's something that is absolutely necessary for folks, all right? A lot of you have had term life insurance since you're 25 years old, okay? It's expiring at 60, 65, 70, 75. Either we want to re-up your term and you want to keep going, or you want to convert that or do something with whole life or final expense, something that's actually going to be used. Final expense is never an easy conversation, but it's a necessary conversation, and that's what we do. We help shop all the different life insurance companies so you don't have to go digging through all the numbers. We'll make that easy. If you want to have any interest in indexed universal life insurance or guaranteed universal life insurance, we can do that as well. There are tons of options, and we will explain all of that to you. Obviously, Medicare's first. That's what we're here to do, but life insurance is also something that you need to take care of your families and help out. So here is our team. We've got Sheila, we've got Luke and Liz. We've got Hunter and Sophia. Hunter is our founder, okay? He is the heart and soul of this organization. That is me. That is photographed in Kauai. We've got Rose, Cody, and Sheila, our administrative staff. So, again, my email, personally, if you have a question, Taylor at MedicareSeniorOptions.com. We have www.MedicareSeniorOptions.com as our website. You can book through there. If you have problems booking, you can go Taylor at MedicareSeniorOptions.com. There should be a golden telephone for you to book an appointment right now. If you do not see that, make sure that you utilize the 1-800-522-2183, and we will get you an appointment. Call, schedule yourself, write that number down. If the line's busy, I already see an appointment coming in. So it's something that book yourself your appointment whenever you have the time. And if you have questions, all right, call 1-800-522-2183. All right, that's what we're trying to do, is get you guys on the calendar and just talk and make sure that you're in the best possible plan for yourself. All right. Well, that concludes our conversation today. You have yourself a wonderful day. I hope that this has been a good, focused, informative video. And if there's anything I didn't cover or something you want me to cover, email me, Taylor at MedicareSeniorOptions.com. Thank you, guys.